Many of you will be able to relate to the types of injuries that I myself have. Adam Giesbrecht of LifeMark Physiotherapy takes care of me.
Today, guys, we're going to talk about some of the common injuries we see as a result of functional training and how we can fix them. One of the most common injuries I see is rotator cuff tendinitis. The most commonly injured muscle is the supraspinatus, which starts at the top of this fossa here, comes underneath and attaches right at the top of the shoulder. Active release technique is something that I use. It's just going to help relieve some of this pressure you feel in the shoulder, so when you're packing castle around in the evening, you're feeling less pain in the shoulder and able to pack your son around a little more effectively. When treating a rotator cuff tendinitis, we generally prescribe exercises in order to improve the strength and flexibility of the muscle and to minimize further damage. Another common exercise we prescribe is middle trap activation exercise. The purpose of these exercises is to help improve his shoulder blade stabilization and improve the biomechanics of the shoulder joint. Some of the symptoms we see as a result of sciatica is people come in complaining of a burning or pins and needles sensation starting in their buttocks and in the back of their thigh and often radiating down to the bottom of their foot. Common exercises we prescribe, Mackenzie method extension exercises. The purpose of this exercise is to allow Ryan to take the pressure off his neurological symptoms and doing this in an active, proactive way in a home-based environment. A second exercise we prescribe following sciatica is front planks. These allow Ryan to stabilize his core muscles and prevent further damage. The third most common injury we see as a result of functional training is patellofemoral pain syndrome. This is just basically that insidious knee pain that people feel in the day-to-day when they do things such as going downstairs, excessive walking, excessive running. And what it is really just damage to the kneecap, and that the kneecap is now not tracking properly within that groove. People often have very tight lateral muscle structures on the outside of the leg and weak muscles on the inside of the leg. Our job is just to restore that balance. One of the more effective treatments we see for treating kneecap tracking problems is functional dry needling, or IMS. Now, the purpose of this treatment is to break up the tension in the muscle and lengthen the soft tissue back to its normal length so that the kneecap is now able to move properly in that groove. Another exercise we prescribe for kneecap tracking problems is VMO squats. This is just a slight variation of squats by turning your toes outward, which allows you to focus on strengthening the inside quad muscles. A second exercise we prescribe is foam roller of the IT band. This allows Ryan to stretch out and elongate those tight lateral structures on his thigh, allowing the kneecap again to track more properly in the groove. So Ryan, how are you feeling now that we finished those treatments?
I feel great. Ready to get back to training, and most importantly, life.
Fitness Fridays and the Healthy Rhino Fitness Challenge, brought to you by LifeMark Physiotherapy, helping you reach your potential.